Hi, I'm Dr. Peterson, Assistant Medical Director with Regions EMS.
Hi, I'm Christy O'Neill, one of the lead operators in MRCC.
And I'm Sherry Shuriak, the other lead operator in MRCC.
Today, we would like to give a brief overview of the East Metro Medical Resource Control Center. The East Metro MRCC is staffed by skilled paramedics with at least 2 years of street experience, many of whom continue to work clinically for a variety of services. East Metro MRCC handles approximately 60,000 calls per year from services in the metro area, outstate Minnesota, and even from western Wisconsin. The East Metro MRCC also provides online medical control for agencies who receive medical direction from Regions EMS, which includes most of the East Metro.
MRCC can provide useful information and arrange many things for you on the scene of an emergency incident or en route to a hospital. Regions EMS and emergency physicians are available for consultation, advice, and treatment orders as needed.
Do you want to give 10 milligrams of droperidol IM?
Copy, 10 milligrams of droperidol.
MRCC operators can also be a great resource if you just need a reminder of something less frequent, such as the appropriate Benadryl dose for a pediatric patient having an allergic reaction, or drug orders for an excited delirium situation. We also can be a second opinion on an appropriate hospital destination for your patient.
MRCC operators have access to a statewide system called MinTrack. MRCC uses MinTrack to receive and disseminate information related to hospital diversions throughout Minnesota, as well as coordinate patient dispositions during diversion situations. MinTrack is also monitored by most EMS agencies and hospitals throughout the state. A useful example of this would be an alert that a CT scanner is down at a specific hospital. This would prompt the MRCC operator to redirect crews with stroke patients to facilities that will be able to provide care. Another example would be a notification about a large structure fire with multiple occupants in a specific city, which could help local hospitals prepare for an influx of patients. Other duties that MRCC can help manage include requests for ChemPACs in the East Metro, allocation of special medical resources, and specialized coordination with on-scene authorities. During an MCI, MRCC has the ability to track patients on MinTrack and direct you to a hospital with appropriate resources to care for the patients you are transporting.
Now let's talk about radio reports. The purpose of providing a patient care report to MRCC is to relay information necessary for the receiving hospital to triage where the patient will go and arrange for necessary resources to be available on arrival. The process for giving a radio report to the MRCC is important so that the operators are receiving accurate, relevant, and concise information. Radio airtime is valuable, and often there are several crews waiting to give reports, including those with critical patients and very short ETAs.
Let's review the guidelines for radio reports. The first thing you should do is switch your radio to EMRCC channel and pause. Make sure there are no crews already giving reports. This is a common problem we experience, and sometimes the radios take a few seconds to sync with the talk group, so give it a good 10 seconds before you transmit. When you hear a crew end their report, give the MRCC operator a moment to relay the report to the hospital, unless you have a critical patient or very short ETA. Sometimes it's possible for a second operator to help out with radio traffic, but they have other responsibilities apart from monitoring the radios that keep them busy. Start your traffic by stating your agency, your destination hospital, any critical alerts such as Code Blue, STEMI, or trauma team activation, and finally your ETA.
April Medic 321 East Metro Control, patient information for United ETA about 10 minutes.
The ETA is critical as it helps us prioritize radio traffic when things are busy in MRCC. Once your crew has been acknowledged, an ideal report should follow this format: age, gender, and chief complaint.
En route with a 78-year-old female from an assisted living facility. A complaint of increased pedal edema. History of CHF, has a pacemaker.
It is important to remember that the information you provide regarding the chief complaint should be brief and really only needs to contain enough information necessary for a hospital to triage your patient to an appropriate room assignment. A full and complete report should be given to the nurse at the hospital upon arrival.
After the chief complaint, your report should include vital signs. Just state, within normal limits, if all of the vital signs are normal. There is no need to give all of the vital signs if they are stable. It is also okay to say the patient's vital signs are within normal limits except for a blood pressure of 190/86. If the vital signs are not within normal limits, please give them in the following order whenever possible: blood pressure, pulse, respiratory rate, O2 sats, end tidal values, glucose, and finally a carbon monoxide reading if applicable to your patient. If your patient received any interventions, report them next. Is an IV established? This helps the ER prepare if you are unable to obtain access in a critical patient. A little known fact is we do not need to know the gauge or the location of the IV. What is your EKG interpretation? This can be as simple as unremarkable unless there are relevant abnormal findings. Did you give any medications? Please include the name of the medication, the dose given, the route, and any changes in the patient's condition after receiving the medication. For agencies under the medical direction of Regents EMS, if you administer any controlled substance, the MRCC operator will give you the name of the doc of the day for your documentation purposes. At the end of your report, please restate your destination and ETA. The main point is short, sweet, and to the point. Your report is intended to get your patient to the right resources at the right time and at the right hospital.
Some additional things that are important for us to know when we relay your report to the receiving hospital. Is CPAP, BiPAP, or a ventilator needed on arrival? Is your patient on a hold? Is security needed in the ambulance bay or in the room? How far did your patient fall? Was there any loss of consciousness? Are they on any blood thinners? For stroke patients, the hospital needs to know the time of symptom onset, what specific symptoms your patient is having, blood glucose, are there family members coming to the hospital, and are you calling a stroke code for your patient? How fast were the vehicles traveling? What obvious suspect injuries have you identified? Is your patient collared or boarded? What is the patient's due date, if known, and how many weeks gestation are they currently? This is important because some hospitals are only appropriate to receive patients after a specific gestational age. What is your estimated total body surface area, degree of burns, and source of injury? What chemical was your patient exposed to? How long were they exposed? What symptoms are they having? And was any decontamination done on scene? Remember that each hospital has its own internal protocols, and your patient may be put through decon again at the hospital, even if they were decontaminated on scene. We will try our best to let you know what to expect after calling the receiving hospital. Does your patient need an interpreter or any other special resources? Is your patient enrolled in any research studies? Is your patient from a prison or currently in law enforcement custody? And is security needed for assistance?
Please remember that MRCC does not need a full medical history or other information that would not help with the immediate triage of your patient. Please save the full story for the receiving nurse. Ending your report with your ETA again is helpful, as sometimes an ETA of 10 minutes when you first hail MRCC turns into 2 minutes by the end of the report. So to summarize, here are the 3 main points to remember from this video for your next radio report. When you hail MRCC, state your service, destination hospital, and ETA. After the operator acknowledges you, state your patient's age, gender, and chief complaint. Communicate any critical information early and clearly so the receiving hospital can prepare for your arrival. Remember, MRCC is a valuable resource, and we are here to help you provide excellent care to every patient. Thanks for watching.